Congratulations on the birth of your baby. It's now time for you to go home. You will hear from your community midwife following your discharge. If you have not heard from your community midwife by 4 p.m. the following day, please contact the ward that you are on. You have 6 weeks or 42 days to register your baby. This is a legal requirement. You also need to register your baby with a GP. It's really important to practice safe sleeping. This will help to prevent sudden infant death syndrome. Things to remember are: no cot bumpers or toys, feet to the foot of the cot. Ensure your baby's blanket is not over the face and tucked in under the baby's armpits. Infant crying is normal. Feed your baby. Change your baby's nappy, remembering that the yellow line on the front will turn blue if baby has passed urine, and comfort the baby in the first instance. Please know that it is okay to walk away from your baby if you know your baby is safe. Do not shake your baby. Babies should not be left in a car seat, ideally for more than 30 minutes, but never for more than 2 hours. No bed sharing or sleeping with your baby in an armchair or sofa, or if you have drank alcohol, or if you are on medication that will make you drowsy, or if you are overtired. Do not leave your baby alone in an adult bed. Do not smoke around your baby. This has detrimental effects on your baby. If you want information on how to quit, access Smoke Free online or see your GP. The temperature of the room should be around 16 to 20 degrees Celsius. Take extra precaution if your baby is premature or low birth weight. Please refer to the Lullaby Trust for more information on safe sleeping.
The signs of a healthy baby include regular feeding, regular wet and dirty nappies, a normal coloured skin tone, a normal temperature which you can check by putting the back of your hand on baby's chest, never go by their hands and feet because they can feel cold, and a normal breathing rate.
Signs of an unwell baby. Please refer to the Lullaby Trust Signs of an Unwell Baby. If your baby has any of these conditions, please contact your community midwife, GP or the Birmingham Children's Hospital. Lethargic, high-pitched cry, fast-paced breathing, a rash that doesn't fade, not feeding well, and an abnormal colour. Vomiting in a baby can be normal in small possets. If it is a large amount after every feed or if the vomit is green, this can be a concern. If the baby's body, lips and tongue turn blue, or if you think the baby has stopped breathing, call 999. Babies should have passed urine and meconium by 24 hours. Please contact your community midwife or Birmingham Children's if this has not happened. Jaundice is the yellowing of the skin or the eyes, and in most cases this is normal. Sometimes it can be related to an underlying health condition and this should be investigated. If you are concerned that your baby is becoming jaundice, the jaundice is worsening, or baby is becoming lethargic and not feeding, please contact your community midwife in the first instance. If this is out of hours, please contact the Birmingham Children's Hospital. Please note that thrush can be normal in yourself and in your baby if you have had antibiotics. If you are concerned, please see your GP. Your baby's cord will fall off between day 7 and day 10. It is normal to see a small amount of blood as the cord is separating. If the area becomes red and inflamed or smells offensive, please see your GP. You can clean your baby's eyes or cord with cooled boiled water. Visit the NHS website for advice on how to bath your baby. You'll be sent home with some leaflets about feeding that look similar to this. Inside here you will find lots of information, including how to know that your baby is feeding well and how to make up and sterilise formula feeds.
Some of the things we encourage new mums to do after having a baby are their pelvic floor exercises 3 times a day, gentle exercise when you feel ready to do so, but if you have had a caesarean section, be cautious not to do any heavy lifting for up to 6 weeks or until you feel comfortable to do so. If you were pregnant when your smear was due, you will need to book it in for 3 months postnatally. Contraception is really important to think about after you've had a baby. Please note breastfeeding is not 100% effective. Please see your GP or sexual health clinic. Resume sexual intercourse when you are ready to do so. If you had vaginal stitches, this may not be for at least 6 weeks or until they have completely healed. Maintain a healthy, balanced diet with lots of fibre and water.
There are some health issues that will worry new mums. Some of the minor issues include: feeling emotional is normal, especially on day 3 when your milk comes in. If this lasts longer, it could be a sign of postnatal depression, and it's really important that you seek help from a healthcare professional. It's also important to remember that this can affect your partner as well, and again, it's really important that they seek help and advice as well. It is normal for your stitches to feel tender. If you are in pain with these, you can take paracetamol and ibuprofen, unless you are allergic or have been advised otherwise. Your community midwife and GP can have a look at your stitches if you are concerned about them. Swelling of the feet and ankles is normal. This is due to fluid distribution. To help this, just elevate your feet. Tiredness after having a baby is normal, so make sure you try and get as much rest as you can. If you think you might be anemic, see your GP. Piles are normal after birth. Please see a pharmacist if you feel like you need some medication to help this. Urinary incontinence is common. However, if it continues or if you get any fecal incontinence, it's really important that you seek advice from your GP. To help prevent this, make sure you do your pelvic floor exercises at least 3 times a day. Breasts can become sore and engorged as your milk comes in. Sometimes your nipples can also become sore. If this is a problem, get your healthcare professional to check the latch of your baby. Your blood loss will be like a heavy period for the first few days, but this should get lighter. You might experience a gush when you stand up or when feeding. This is normal.
Please call triage if you experience any of these more urgent symptoms. If you have any headaches when accompanied with either visual disturbances or nausea and vomiting. If you have had an epidural or spinal and have severe headaches which improve on lying down. If you pass any clots bigger than a 50p piece, passing a lot of clots, having offensive blood loss, or you are concerned about your blood loss, please call triage. If you feel generally unwell, have a raised temperature, are feeling hot and cold or shivering. If you have red, hot and painful areas on your breasts, which may be accompanied by feeling unwell, may be a sign of mastitis, but please do keep feeding your baby. If you have any swelling, pain or redness in your calves, or if you feel that the skin is hot to touch, this can be a sign of a blood clot. Preventing these clots, be as mobile as much as possible and keep yourself hydrated. If you were given blood thinning injections from hospital, take these as prescribed. Take the cap off the injection and pinch the stomach. Place the needle fully in and push until you hear a click. The injection should look like this and place in your sharps box that will be provided to you before you go home. Also wear the tight stockings if you were given these from hospital. We recommend you wear these until you are finished the course of your injections or back to your pre-pregnancy mobilisation. If you have any of the following symptoms, please call 999. A sudden onset of heavy bleeding that doesn't stop, and if you have any chest pain or shortness of breath.
If you have any questions, ask your midwife. Useful numbers are on the screen now.